Dear patients, I am here to address something that is really important to me and my journey here as an eye care content creator. I've had some of you in my DM saying that, Doctor, why do you address us as your patient? Why do you call us patients? I'm not your patient and all that you people say in my DM. Funny enough, amongst the 5 persons that have raised this consigned question about my conversation starter, which is dear patient, 4 out of the 5 are my passive viewers or followers. What I mean by passive viewers are people who watch my video, probably they enjoy my content or post, but they don't react or like, because I had to check. I've never seen them react on my video or comment in any of my posts, except one who also know me in person. Doc, why do you address us as your patient? And I had to give him my reason. The remaining 4 are people that I've never seen their like or comments in my videos or my posts. But notwithstanding, I know that most of you too that are my active followers or viewers must have also have this concerning question to ask me. So that's why I'm here to officially address it. Now, let me go back to how I started making eye care content. I had a friend that was around 2022, had already encouraged me to start making content prior to the time they were in doctors. Like, I didn't really buy that idea. Then until 2023, when Plot Point Stories interviewed me, and after that I said, Doc, why don't you use this opportunity and start making eye care content? There are just few of you online, and this little time I've spent with you, I think you are good at what you do. So why don't you start doing content? I was like, I won't have that time, seeing patients coming back, this, that. So I gave numerous excuses, and he kept pushing me. He was even the one that taught me how to edit. I am the one that do my video editing. I've never given someone to edit a video for me before. It was this Plot Point Stories that took time to teach me via video call how to edit my videos. That was when I started content creation in 2023. As at that time, I usually do like one video a week, sometimes 3 videos in 1 month, because I didn't still, it was not like I didn't see the urge to be posting every day just like I do now. Now, it was in 2024 when I worked in a government hospital or in a public hospital that I saw the reason why I should be making this video, even though I have not started earning. So this is what happened. In that public hospital I worked, every Tuesday was usually our surgical days. And then I was close to our surgeon, who always will carry me along every surgery. He would say, Dr. Kerry, where are you? Then 2 of us and other nurses too will go into the theater. Sometimes we usually start these surgical procedures or process by 10 a.m. Sometimes 8 a.m. 8 p.m. we are still standing there operating people. Now, there is no Tuesday in that hospital that they don't do surgery. And now in a day we operate at least 50 people. Now, amongst these 50 people, about 20 of them are young people, and they are undergoing that surgical procedure due to preventable, something they would have prevented, avoidable eye disease. So that touched me. At some point, I was even traumatized because of the case. It was there I saw eye cancer with retinoblastoma. Another thing I noticed was that apart from those that undergo surgical procedures, there were those that also lost their vision due to other minor preventable eye diseases, something they would have avoided if someone had told them. And for those of you that have been in public hospitals, I say holiday, that have been in public hospitals, you will know that in public hospitals, the place is always choked, it's always busy. So sometimes most doctors don't even have time to start telling you, okay, so this is why you have this thing, this is why you don't have this thing, or start asking your question. There are people in queue, the reception is choked. It's not like this place I'm working that I have time to do, or that time I don't even used to have time to do, because we are always busy. So after experiencing this, one day I asked myself, how do I help these people? How do I? Because I handled several cases of patients losing their eyes due to ordinary mere rubbing of eye. Just like that's why sometimes if you are watching my video, you know that I usually make videos. Don't rub your eye, or don't do this one. It's because most of the videos I even come here to make, I do them based on experience. I will not come and tell you people to learn. So that was how the whole idea of making eye care content came. That was how I had to like not take it serious, unlike how I used to do it before. If those of you that watched me 2023, you will notice that there is a difference between how I make video then and now. That I now tell you people more stories about things that happen in the hospital, how it happened, and what you should do if you are in this person's shoe. So in order to answer some of your questions that we are not able to answer in the hospital, that is why I now do it online, so that you watch and learn. Now, why am I telling you people this story of how I started my eye care content? I'm telling you because the whole essence of my content is patient. My patients are my audience. So my content is a mini clinic. I am seeing it as if I am talking to a patient. You might not really be that patient, but my audience are patient. That is why I say they are patients. In fact, those of you that are even seeing it as a big deal that I'm referring you people, or I'm referring my audience as patient. If you wear glasses, you know you're my patient. Some of you even wear glasses, but you don't want to accept that you're a patient. If you need glasses to see you're a patient, you're my patient. You don't need to, I don't need to physically attend to you before you know that you're my patient. If you need your glasses to see, you are my patient. If you need glasses to read, you are my patient. If your eye they eat you, you are my patient. Even if you are not any of these things I mentioned, if you have your mother, your father, or your uncle, some of you might have your mother, your uncles that have 1 or 2 eye problems, and then you will, when you watch my videos and learn this thing, you go and teach them, tell them, there's one doctor I used to watch on, but this is what she has said about this thing, this is your eye condition, this is what we should do. And some of you self that are even saying, I call you patient, I call you patient. Some of you snap your mother's eye and send to me in my DM and start asking me what you should do and what you should not do. Why do you send me a picture of your mother's eyes or your relative eye that have eye problem? If not that you have been watching my videos and you know that my video is educational. So the essence is that I am not calling, I don't know how to put it. The essence is that my audience are patient. So if you are watching it, but you are not patient, but you know that you enjoy the educational content I bring out there. You're a patient for eye care education. So you're patiently learning. That makes you a patient too. Even if you're not currently my patient, you might be a patient in future. I know some of you start saying, God forbid, patient, no problem. But I don't want you to start saying like, I'm wishing you to be sick, I'm wishing you to have eye problem by saying they are patient. No, my audience are patient. Patients who come to the hospital, patients who need eye care education, patients who need eye care advice. Those are my audience. That is why I say they are patient. I am not going to stop it. I'll keep addressing my patients as their patient because they are there to me. Very soon, I'll trademark this dear patient, so that one of you will not come out one day and go and trademark my dear patient and tell me that I don't have rights to say dear patient again. You are the CEO of their. Please, this is for me. It's my trademark. Nobody should drag it with me. Thank you for watching.